SleepTech Talk is brought to you by Fisher & Paykel. Fisher & Paykel Healthcare is a leader in CPAP mask design and innovation for over 20 years. Their unique technologies have benefited millions of OSA patients through their top CPAP masks. These advancements continue to further enhance patient experience and outcomes.
Treating my sleep apnea has renewed my appetite for life. What matters to me now is giving my family a little treat.
All right, it's time for another show, and you know what that means? It's time for pre-calibrations. So what's going on today, folks?
Hey, Jerry, we've got with us today Bretton Lane. She is the President and Chief Operating Officer of Professional Services at BetterNight. With over 25 years of experience in sleep medicine, Bretton began her career as a sleep technologist at the prestigious institutions like the National Jewish Health Center and also the Children's Hospital of Colorado. She's overseen thousands of sleep studies, led clinical operations, and is passionate about making high-quality sleep care more accessible and effective for patients. She's here today to talk a little bit about her expertise in the space and, maybe give us a little bit of insight into the latest, innovations related to sleep apnea care and sort of the world that is BetterNight. So we're excited to have Bretton with us today.
Well, I am excited to have her on. I've known Bretton like you have for years, and to just get to hear her end-to-end story is going to be fantastic because she's one of those people that, like you have in your career, Robert, has evolved as the industry has evolved. And so I'm excited to hear how she got here and sort of the backstory maybe that I haven't learned before.
I'm fascinated by people like her that got into sleep and then, moved on and ended up building a business and their own company. So for me, it's going to be exciting to hear that part of the story.
Well, we've certainly met a lot of really smart people who are extremely motivated to be successful, and Bretton fits into that category specifically. So let's talk to Bretton.
Yeah. All right, on to the show.
SleepTech Talk is sponsored by React Health. Within our LunaPap device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our LunaPap device line while accommodating diverse patient requirements.
Lights out.
Welcome, everyone, once again to another episode of SleepTech Talk, the Sleep Podcast, with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Monicro. Folks, once again, an amazing guest for an amazing show just for you. But we do want to say thanks for all the love you've shown us, all the likes, the views, the shares, and the subscriptions. Let's keep subscribing. Talking about subscriptions, we've noticed that it's barely a small fraction of the people that watch the show that are actually subscribed. So be sure to hit that subscribe button. That really helps the channel and gets the word out for all the sleep professionals out there and the sleep curious. With that being said, let's not forget our lovely sponsors. Thank you so much to our sponsors who help make this show happen. And because of them, we're able to bring it to you. So be sure to check them out. A huge shout out to them. With that being said, Robert, what is going on today?
Hey, Jerry, we have a fantastic guest today with us. We have Bretton Lane. She is the President and Chief Operating Officer of Professional Services at BetterNight. Bretton, we are absolutely thrilled to have you with us today. We typically jump into the conversation and, we want to know a little bit about your history and how you got into sleep medicine. You've been doing this a while, kind of like the other three guys that are part of this podcast. So tell us a little bit about yourself and how you got into the world of sleep medicine.
Yeah, thanks. Yeah, thanks, Robert and Emerson and Dr. Mann for having me here today. I've had I think in some ways, sort of a typical story. I fell into sleep medicine. You probably hear that from a lot of people. I graduated from college at the University of Nebraska in Lincoln, and I decided that I wanted to learn to snowboard. So I went to Denver, Colorado, moved there, didn't know what I was going to do, didn't know anything. I was a biology, biochem major, thought I was going to do cellular, in the lab, cancer communication, genetics, that type of stuff. So I went, started advertising or looking for jobs, interviewing, kind of going around, and started running out of my post-graduation monies and happened upon National Jewish Medical and Research Center. At the time, it was run by Dr. Bob Ballard, and quickly after, a couple years later, Dr. Teofilo Lee Chong joined. But I got hired, and I actually got hired on as a sleep technologist, initially scoring during the day, not actually working at night. And I and it was kind of an interesting story because the day that I got that job, I actually got a job offer from the American Center of Cancer Causation and Prevention, exact same day. And my pathway was going to go one direction, but I was just so fascinated by what I saw at National Jewish to be a sleep technologist and what was going on, and I just said, this is what I'm going to do. And so I joined, got started. And I always tell people it was 2001. So, but I actually started in this field at just $12.47 an hour as a sleep technologist. And so of course I couldn't necessarily afford, even in that day, to live in Denver. So I actually started moonlighting at Children's Hospital as well in their pediatric sleep lab in the evening, scoring sleep studies for them, learning about the children's side of it. And I just got steeped the first 5 years of my career in Denver, Colorado.
Awesome. Well, Bretton, you certainly have made your way from, a daytime scoring tech and a children's pediatric tech as a secondary. Thinking about how things stand for you today. I mean, you're part of BetterNight, a national service provider, and you're certainly seeing, or you've been a part of a lot of change with BetterNight as the company has developed, and you've been a big part of that. So tell us about, sort of your journey in leading the charge of a big national sleep company and what that's been like for you.
Yeah, I had several experiences. National Jewish was just a great place to get those initial experiences. I mean, hands down, working with Dr. Teofilo Lee Chong and Dr. Aloya and others, and getting that type of standard, I think, within my system was really great. And then I decided I wanted to move to California, and I got the opportunity there. I fell into it was a private practice, but a really nice large group called Pacific Sleep Medicine, who did a lot of pharmaceutical trials. They were 7 branches in Southern California, 1 in Oregon. And I got the opportunity to get involved in 2007 in the world of mergers, acquisitions, growth of sleep centers, et cetera. And so, I had done everything at that point in time. I had transitioned into operations from technical director, lead tech, to technical director, to operations. Was general manager at that time of the Western region. And then I kind of got I was getting on to year 9 and my growth, and I was seeing all these other new things come out. It was just 2010. There was a lot of home sleep testing happening. People were starting to use modems, but we weren't all putting modems on our PAP therapy patients at the time because it cost more money. Those, machines were more and it wasn't necessarily required yet. And so I came across a much smaller company in San Diego, California, and came on as operations manager. I was employee number 20. And they had been doing home sleep testing in the managed care environment from 1995. 2 women started the company. One was working at the VA in San Diego, and the other one was working at UCSD. They went to Europe, bought 2 home sleep test recorders, and started Sleep Data. And by the time I met them, they had some pretty good managed care contracts. They were well known on that diagnostic testing, and the medical director, one of the major medical groups, had asked them to get involved on the DME side as well. So they had started the DME company for therapy. They had just gotten a VA contract, and that's why they brought me on. They were really starting to kind of pick up. From there, we had some changes in ownership, but we really had the passion of those initial founders of, doing well by doing well, doing good by doing good, but of making sure that patients were compliant with therapy, even though they were home sleep testing. We used to tease them because they would say it was value add to call, and we'd say from the business side, we'd say, well, there was no money, it was free. I mean, but they would always call and say, how are you doing? Have you gotten set up on your CPAP? What's going on? And they would start coaching from there. So from there, we started to collect data. We collected data from all the PAP therapy machines. We collected data throughout our EMR. So we really started to have this journey, not having a medical practice other than the diagnostic testing, but we started having this journey working with specialists like sleep, pulmonology, cardiology, but also PCPs to get patients through managed care environments for home sleep testing and then onto therapy. But then long-term chronic care management. So we had created a real nice database, care management, population management reports, and this was like 2013 we were getting. So we have data going back. Now, we were touched like everybody else by recalls, by 2G networks not being supported, 3G networks not being supported, changes in algorithms, but at the same time, we still have data going back, that far on patients using that's tied to their diagnostics data. And so we had some various iterations. We actually started a company that was a CBT. It was called Optisam. And we were looking at we worked with Derek Lowy. He's big in cognitive behavioral therapy. And we kind of used his cool tools and created a CBTI program towards employers to improve presenteeism, to improve sleepiness on the scales. And we actually published a paper with Deborah Lerner and showed ROIs on that and everything. Deborah Lerner out of Tufts. But we really couldn't take off at that point in time. It was a very different sell going into employers, going into more of that wellness space on that particular side. And the market really started shifting in about 2015, saying, come back to sleep apnea. We need a sleep apnea solution going end to end. So with all my regulatory experience that I had gained with mergers, acquisitions, and then with a lot of additional regulatory and legal support, we created the foundation to go on all 50 states and be able to provide some or all of our services, with the exception of dental sleep medicine. We kept a dental sleep medicine company in San Diego at that period of time because that was something we had added as well, knowing that you need all of these types of things to treat a sleep apnea patient. And so we really believed in the dental sleep medicine side as well as a part of that team. So we took that, and then we were ready to go. We actually had just started two things had happened for us. We had just started in December of 2019 and November of 2019. We had just released our very first MVP of the BetterNight solution. It was end to end, and we were really working in the truck driving DOT area, trying to reach those types of patients, chain of custody protocols, all of those things. But we had it set up so that we could do everything virtually. And we had done research and published research around virtual masks or virtual setups versus not. Everything was validated. Very excited. And we had actually happened to have changed our phone system from an algorithm server-based phone system to a virtual phone system. And about 3 months later, we all got the government shut down. We all had COVID, got COVID, everybody go home. And we were San Diego based at the time. Now we're based all over. People work everywhere, almost every state probably for us. But our IT team was just amazing. They used our oxygen trucks, put together a protocol, and just dropped IT equipment and did virtual setups. In 2 weeks, we were up and running, end-to-end sleep program all through COVID. And unfortunately, a lot of the sleep techs and the sleep labs that were hospital-based had to go on a pause and had to go help, with COVID testing and sorting and trading, and we just got running. And there was a real need for us, and people embraced telemedicine, as we all know, faster than we thought they were going to embrace it. And that got us here. I think we've grown the company by, top line almost 30x now. So
A sound sleep calls for a high-performing mask. Introducing F&P Nova Nasal with swing fit headgear. From fitting and seal to minimal noise and draft, it's performance defined. Go to fphcare.com/Nova Nasal to learn more.
Treating my sleep apnea has renewed my appetite for life. What matters to me now is giving my family a little treat.
Wow,
Been big.
Bretton, it is quite a story. And fortunately, I've been able to have these intersections in your life along that journey, which has been pretty amazing. One of the things that's fun about you is, and both Jerry and Robert are a part of that, is the busiest people, and you're in that class for sure, do other stuff. So along with all this that you do, you're on the editorial committee for the AST's A to Z magazine, and lead that committee. So, and you were on the board a few years ago on top of that. How important is that though? Because as we talk to as we think about our listeners, and they're like, I just don't have time to give back. I don't have time to invest in that. How has that been important to you? Because you're running a company and making time to make sure we have great content in the A to Z magazine with the AST. How do you make all that work?
Well, I mean, I think first of all, I'm very passionate, about sleep medicine as we all are. It's something easy to fall into. It makes so much sense. You've got your diet, your exercise, your sleep, and some water. Those are the things you need to really be here. And so it just makes so much sense to overall, general health. And you think when you participate in these volunteer acts that it's a huge commitment. It's as much of a commitment as you want it to be. So you can do things intermittently, you can do things, ongoing, you can do things for a while, pull back because you're in a really busy time. The AST has been great for me for that. At times when we were going through great change, I said, hey, I can't do the board, but I can do, the committee, the AST committee. So I think that's the part. I think people get daunted up front. And when I'm trying to recruit people to come, participate and do volunteer work, it's one of the first things. I'm so busy. I know you're busy, but literally it's maybe 15 minutes a month, and then every once in a while when you're able to write something or look at some regulations, whatever committees you're on. And I'm sure the BRPT has the same thing from our colleagues that participate on that side as well. Why is it important? Because sleep's important, but because our environment is changing so much. And it's just evolving into so many different places. I think sleep is one of the last places that you can actually have a clinical career and profession without the traditional educational program, whether it's an allied health certificate or others. I mean, you can go and you can learn and you can really create something out of this. And you don't just have to, do DME setups or do in-lab studies or scoring or operations. I mean, you can get into sales, you can get into product development, technology, marketing, you can go to retail. I mean, there's just so many things you can possibly do that I just think it's such a huge opportunity and it's such a need. We're running so short on sleep techs. One of our acquisitions we recently had in New England, it's so underserved. Everybody's having a hard time. This is across the country too, but staffing and taking care of patients that can't be taken care of. One, it's not sleep apnea, it's some other sleep disorder, but two, they're too complex to be dealt with at home. And we can't find staff to actually do those anymore. And so we need this. And you can't just say, somebody who comes from respiratory therapy or EEG can be a sleep technologist. They have to go through their own form of sleep training too. So all of these people, whether they're certified in some way or not, need to become sleep medicine specialists to practice here. And we do that. And it's important that we contribute and make sure that we build that for the next generation of people who aren't going to run PSGs on paper, but they're going to do something really cool.
Yeah, no, you're absolutely right. And I think that the fun thing about hearing your story, kind of end to end, is you've remained curious along the way. And it's, allowed you to see this evolution of sleep from I'm going to go snowboard to, now you're running a company, you're leading teams, and then you're volunteering on top of that. So, huge thank you and kudos to you for, following this journey. And we're all the better for being a part of it.
Oh, thank you. Yeah, I appreciate all of you as well. We're all on the same mission. So
So, Bretton, like Emerson said, it's very inspiring to hear what you've done, and it all started out with snowboarding. But if there's somebody young that's curious about a a career in the sleep industry, they're just starting to hear about it, what kind of words of wisdom would you have for them? Because obviously you've tried so many different things along this path, and you've also named so many different options. What sort of advice would you give somebody who's curious to in getting into this field?
um I would tell them to reach out to the AST or BRPT. I sometimes you come across somebody who's, really special. You find somebody who has time that actually has done this. You maybe within your group or your friends or your school, there's somebody that can actually tell you about this. Recently at Sleep Tech, I just happened to be visiting a lab. She was a frontline customer service person, and she just happened to cross paths with me. And yeah, we're going to start training her as a sleep technologist. So there's that way. But the other way is that there is so much information about what you can do. It's free. How you can get your career out, who you could talk to. If you get on their websites, if you Google them, you'll find their groups. You can reach out and say, who can I talk to? I'm interested in this field. And they've intentionally created a lot of materials to help people understand what that means to them, what the pathway is like, and what they could do.
Well, so Bretton, just thinking about sort of the future state, knowing we've got all of this AI, and I think that if I remember correctly, you guys have been able to incorporate some AI tools into your systems and your patient interactions. How does all of that work today, and how have you found this new technology to be beneficial for patients and patient care?
Yeah, 100%. We're just the next 3, 5, 12, 20 years, it's amazing. It's scary and it's amazing, and we have so much stuff to go forward to, but this is something that it needs to be attended, it needs to be supervised, it needs to be developed. And if we don't pay attention to it, if you're not looking into something and applying it to your personal life or your professional life, life's going to get harder and harder for you. So, we started and things that, and the thing is too, is all of this stuff at least in our country, you have to have a top line and you have to have a bottom line. And so at the end of the day, if you're going to survive and continue to do all the good things that you want to do in the field of sleep medicine, you have to figure out ways to do it that are going to be good, are going to help. One of my mentors said this word to me once. She said, Bretton, is it core or chore? And it's really stuck with me. And so I think when it's a chore, then that is a place possibly for AI. So, and we all know we have scoring, sleep scoring, and going through there, but just running through and doing some analytics and getting that there, that's kind of a chore. The core of it is having that sleep technologist that goes through, that validates it, that looks at it, that then interprets that story and hands it over to the sleep physician so that they can take their next piece of it. So same thing, that back wrangling, that's a darn chore, that is hard. And so we have solutions now that are out there that are just phenomenal in pulling things off the facts and getting them into our system so that qualified people can look at it and say, this is what we need to do with this particular patient. And it's so much faster. And there's there's so many other ways to apply these things. It's going to take time. We're not going to be right every single time, but on how we use it. But we have to bring it into our industry. We just have to.
So, Bretton, I was to piggyback off of what Robert asked, and we are getting close to time, but I have to ask this question. For current sleep technologists, people that are in the industry right now, there is, for some people, they are afraid of AI coming for their jobs, so to speak. Any words about that to them?
I have not yet seen us not needing sleep health professionals. We actively look at it. We constantly have job ads up. I constantly see other people have jobs up. One, we all know each other for the most part in this world. And so there's always that, oops, mea culpa, I just took your sleep tech, and then we took yours, we go back and forth. We want you, we want you to be here. We want you to be a part of this. AI does come on board, but you can't take away that patient interaction. This is a patient-facing solution, even when it's virtual. You have to have phone calls. You have to have meetings like this virtually now, right, with patients. And you have to, obviously, in the sleep center, be able to handle those patients as well. You have to have a territory manager that can go down and can talk to physicians and tell them why it's important to screen for sleep apnea, and really get in there and talk to them about their cases and their practice and how it aligns and customize it along the way. And so there's just so much that's needed with this type of knowledge and background and operational status that can be applied across so many various job types within the sleep industry.
Bretton, the story of BetterNight and all that you guys have done has been phenomenal. When you sort of take a step back and synthesize all of that, the beauty of today is we get to really hear the heartbeat of it. Who is Bretton Lane and the organization you run, and it's really, I think, captures the soul of the organization. But when you look at your success across the 50 states and the growth that you guys have had, what do you feel like is that real heartbeat? What really, for the tech who would love to work with you guys as a tech or a coach, or the patient who would love to be a part of your services, what is it that makes BetterNight so special that you guys have had that success that would draw patients, draw other caregivers to be a part of the BetterNight family?
Yeah, I mean, I think it starts with the problem. The problem that exists out there today is that only 25% of or what 20% of the people in the United States, 25% of people in the United States probably have undiagnosed sleep apnea, right? Or have sleep apnea. 80% of them are undiagnosed. So that's where the problem exists. We have a lot of work to do, and it's very motivating to tell people the story of why they're doing what they're doing and where we're going. And I think that when you come to BetterNight, you have a lot of talent. I have people that I've worked with that are clinicians, Dave Parento, Billy Heavener, others who have been a part of sleep medicine and passion back into the early 2000s and even 1990s as well. So I've got these physicians who have been in it just as long, and they're just so passionate about what we do. Business is hard. Business goes up and down. The world changes. Some things work, some things don't work. But that core group of feeling and people that really want to make this work and persist even through hard times exists at BetterNight and really wants to make a difference.
Bretton, thank you so much. This has been fantastic, but we are out of time. Is there, where can people get in touch with you or learn more about who you are and BetterNight?
Yeah, well, I'm on LinkedIn, Bretton Lane. You can look for me there. You can go to www.betternight.com and we have our website. You can look at what we're doing and have access. We've even got a jobs page. So
Awesome. Thank you so much. And we'll be sure to have that information in the show notes. And folks out there, thank you so much for joining us once again. And be sure to check out our sponsors. A huge shout out to them once again. And until next time, we say lights on.
Be sure to check out our clinical sponsor, Sleep Review Magazine. More details in show notes.
All right, that was another show, and it was quite a show. So that means it's time for post calibrations. What'd you gents think?
Jerry, I think that, when you look at someone like Bretton, her journey is, really the best part of what we do here at SleepTech Talk. It's really capturing innovators, entrepreneurs, people that are curious, that think outside the box. And when you think of somebody, as we talked about on the show, that started out just wanting to snowboard, and here she is, leading a company that's in all 50 states. It's wildly successful. And it does something that's really interesting to have been fun to really dig into, is their end-to-end level of care. She kind of touched on it a little bit, but I just love how she stayed curious. And then on a personal level, with the AST, she definitely does not have time to volunteer. And yet she's another one of those people that gives back, even though her incomplete calendar is full every single day. she finds time to give back to her profession. And I think that is just really telling of her character. And as I noted in the show, it's kind of the heartbeat of who BetterNight is. And it's just fantastic to get to hear that.
They were one of the first companies that I remember Emerson really putting out information related to value-based care models related to sleep. And it feels like they were ahead of their time, and she sort of alluded to that too with some of the programs and services. My guess is we're probably going to circle back around to some of the things that they worked on early on, and they're going to be well positioned to be able to um, you know be successful in this sort of future state of population health, having a population health approach to treating patients with sleep issues.
This word success, we and successful, we use quite a bit when talking about Bretton and Better Night. I think what's the core of it, and you, Emerson, you asked that towards the end of the conversation, is, what is the core? And if you heard something throughout, it was passion and taking care of those patients. And I found that really, really valuable because at the end of the day, that's what she wanted to do is take care of those patients. She talked about an underserved area when that recent acquisition that they made, and they just don't have enough people to take care of those patients. And she really wants to do that for them. And then when we were talking about AI and that sort of thing, I was like, no, you can't replace the human touch. We really have to provide care for the patients, and it's for me, it's really nice to hear that somebody cares and somebody at her level, chief operating officer, president, that I still care for the patient, right? It's not. She said business is hard; it goes up and down, but the care doesn't go away.
No, I
No,
think you're right. When you're purpose driven, these things happen. You're led by the right things, and
Right.
the patient stays first. Your employees are still important. Quality still matters, and then at the end of the day, your growth is exponential because you're focused on doing the right things for people. And when you have that kind of purpose, the fuel from it is fantastic. What were you going to say, Rob?
I remember back in the day that the company SleepMed, they had something in their mission statement this is a terrible version of it, but it was something to the effect of take care of patients the way you'd want to take care of your grandmother or something like that. It was something to that effect, and it always hit me that was in there. That was something that was on their website and built into the mission of take care of a patient the way you'd want your grandmother to be taken care of. So doing the right thing is absolutely the best way to is the best way to do business.
She mentioned Dr. Lee Chong, and
Yeah, we got to get him on the show.
yeah, we do. But talking about doing the right thing that Emerson said one time in an email, Lee Chong had put that in there about Emerson saying that doing the right thing. So it's not something
Oh
new
wow,
that Emerson. Yeah, exactly.
he's
Yeah.
quoting the great Emerson Kerr.
Oh
Yeah.
boy. Well, you know what? It's so funny you say. I actually said that to someone the other day. I said one of the best moments is when you hear someone quote you, and they didn't know where it came from. And
Mm.
it's that's really a neat thing. And not saying that she was quoting that, but I think that's part of the fun part of what we get to do is we get to reach so many people, whether it's through our podcast or through our careers. And it's just been a fun journey to get to do that and to be a part of the national conversation. I mean, SleepTech Talk is that we are the national conversation for sleep technology and sleep tech, and it's an extraordinary place to be. And I know all three of us are honored to be there.
Yeah. Hey, and speaking of that, Emerson, I know this episode will come out before this takes place, but the your host of Sleep Tech Talk have been invited to be the keynote speakers at this year's Current Concepts meeting in Florida. So look for us in August. We're speaking on the first day, I think, early in the morning, maybe 8 o'clock, I think, and we're going to talk about sleep diagnostics, the sort of past, present, future, and same thing with sleep apnea therapy. So stay tuned. We'll talk about that a little bit more on future episodes.
Yeah,
That's a
all
good
three of
point.
us.
Yeah,
Yes,
we're looking
looking forward
forward
to
to
that.
But I did want to say a couple of things, Emerson. I would challenge you about being the national voice and say it's international because we've had
There you go.
people
Yeah.
from other parts of the world on our show, and it's
You're
exciting
right.
to say that. Number two is I've also been quoted before, but I can't repeat those words on.
It's a family friendly show.
That's
Yeah,
right. That's
we'll try
right.
to keep it as family friendly as possible.
There
Yeah.
you go.
Yes.
All right, I think that's a good place to stop. If you guys think you gents agree.
Yeah, good show.
Good.
All right, folks, thank you so much, and until next time, we say cheers.
Hello, I'm Massey Arrington, President-elect of the American Association of Sleep Technologists. I wanted to reach out and let you know that the AST is your professional home and chief advocate. As an AST member, you'll gain up to 22 free CECs annually. You'll also have access to technologist-specific education, as well as the community and advocacy that you need to advance your career and improve patient outcomes. With the AST's new strategic plan tackling sleep technology's biggest challenges head-on, now is the time to advance our profession together. Visit astweb.org and discover where you belong.